My name is Juan Spiniak, and I'm a STM fellow graduating this term. Prior to MIT, I worked in a telecom service provider where I was involved in several network projects, including one of the first fiber-to-the-home projects in South America. It is my distinctive pleasure to introduce Professor Deborah Nightingale, Professor of the Practice of Aeronautics and Astronautics and Engineering Systems at MIT. Professor Nightingale has more than 35 years of experience in academia, the private sector, and government. She joined MIT in 1997 and currently serves as co-director of the Lean Advancement Initiative, a joint industry, government, and MIT consortium. She was recently appointed director of the Center for Technology, Policy, and Industrial Development Center, an important research arm at EST. Her research includes lean enterprise integration, enterprise architecting, and organizational transformation. She's a member of the National Academy of Engineering and a past president of the Institute of Industrial Engineers. She holds a PhD from the Ohio State University, Industrial and Systems Engineer. Please join me in welcoming Dr. Nightingale.
Irving and I decided that we should have the Media Lab help all of us engineers with our presentations, and so it was very nice. But I want to talk to you this morning about a really important project that we just recently engaged in here at MIT, and something that I'm really honored to be involved with and working with, and hopefully will assist using systems thinking and enterprise projects to look at the whole post-traumatic stress environment in cross-military services. So we've long been looking at enterprises. Part of our role in LAI as our focus has been looking at enterprises as systems. And in those enterprises, we do look at people and processes and organization, information. We look at technologies. We start with the strategy view, and we have taken a very holistic approach to how we look at systems. And one of the things that we've had the opportunity to do is to look at a lot of different enterprises, ranging from companies and organizations to logistics centers to large-scale government organizations to acquisition opportunities. And we find that there's been some common kind of themes and tools and methods that have emerged out of this. Well, a few months ago, and actually now a little over a year ago, Dr. Tenley Albright from the Collaborative Initiative approached me and asked me to talk about applying some of this thinking to the role of looking at post-traumatic stress, something that is now affecting unbelievable numbers of people in our community. One of the things that we know is that the current system is woefully inadequate, insufficient to really meet the needs of our returning veterans. And Admiral Mike Mullen, who is the chairman of the Joint Chief of Staff, is personally extremely committed to this project, and he is actually our sponsor on this project, which is making it really a great opportunity. But I think it's something that all of us, almost every one of us, in fact, how many of you have been touched by someone that has returned under stress? I think many of us have. And one of the things that we're seeing is that this is now impacting many people. So what I want to talk to you today about, though, is how we're using some of the methods and tools that we have used in some of these other enterprises, and how we're embarking on our journey and now using this to examine post-traumatic stress as a whole, from a systems, total enterprise perspective. So one of the methods that we have used in all these other enterprises I talked about is the transformation roadmap, that starts with, and I'll go through these in more detail as I go through this, it starts with a strategic cycle where you engage the leadership and get involved in understanding what is it that you really need to do, and how do you go about looking at it from a total system. The second part involves a planning cycle where we look at, from a system standpoint, the current state, how do we envision and design the future state, how do we align our structures, behaviors, and in creating a plan of action to correct and close those gaps between the current and the future state. And then the last part is moving into execution. So what I want to use this morning is this framework to talk about how we're now approaching this significant problem of national and international dimensions using this methodology. So I'm going to give you some examples, and I will tell you, though, that we are in the early phases of this, but I wanted to share with you our thinking and also to solicit any inputs or feedback that you might give us. So let me start with articulating the case for transformation and conveying urgency. This was actually not a difficult one to do. This is something that the whole nation is very engaged with, and we have seen this, unfortunately, to be a significant pathology of war, and particularly of the current war. There has been anywhere estimated from 5 to 20% of our returning veterans have some form of post-traumatic stress or other related issues. We're spending over $2 billion on this, and we have over 125 different psychological health programs. Now, therein, when you start to look at some of those numbers, first of all, you understand the magnitude, importance of this problem, but also, when you start looking at 125 different health programs, it starts to tell you something, right? It says we don't really understand quite what works and how to deal with some of this. So there's also, we're seeing huge challenges in terms of access and the quality of care. And so depending on where you are and where you come back to, some of the more rural areas don't have the same access of care. The quality of care varies significantly. There's still a major challenges within the military in terms of culture and stigma, and the military is doing a very, very great job of trying to change that, but it's a culture that's been embedded for a long time. And so just getting people to even admit to having some of these problems has been an issue. What we're starting to see now is a huge impact on the families. So we're now seeing significant influence of the families, the spouses and children of returning veterans, parents even, now needing more psychological help and being under more stress as a result of this. So it's a very significant issue. And so one of the things that we're doing, I think one of the first times, is taking a total enterprise systems look at this whole system. And Norm Augustine, who happens to be well known to many of you here, has been on the ESD advisory board and is on our advisory board for this project, is very much involved in terms of promoting systems engineering, and has been an advocate of systems engineering certainly in the technical domains, the product domains, for many, many years. But now Norm is speaking out and saying, as part of the reason that so many issues in healthcare are difficult to quantify is that these societal problems are much more complex, they're much more qualitative in nature, and part of the question that we're being asked is, where should we be spending the next amount of money? Should it be on prevention, on research, on treatment? And I think this applies very much to this problem statement, is frankly, there's a lot of money being spent, and one of the questions that the senior executives in DoD are asking us is, where should we be spending this money? Should it be on prevention? Should it be on treatment? Should it be on the systems themselves? We are looking at the total system on the whole continuity of care, from prevention and resilience, and there's a lot of work that's being done right now in resilience training in the services, the identification and treatment, and then all the way through to rehabilitation and reintegration, whether that be within the service or back with families. So we're looking at this whole continuum of care, and I'm just trying to understand, well, what's working today, what's not working today, and where should resources be focused? So the challenge that we've been given is to develop innovative recommendations, and what I have the emphasis on innovative because there's a lot of things going on, but they're wanting us to kind of pull all this together to come up with recommendations for how do we transform the military enterprise, not just the health enterprise, but the whole military enterprise, to better manage post-traumatic stress and its related conditions in support of the warriors and their families. And we have made the warriors and their families as a central part of the system that we're looking at. I should mention that in addition to LAI, we have members of the Collaborative Initiative, and we have several researchers within LAI, and we have 5 grad students from ESD that are involved with us in this project. So this is a fairly significant project of resources. So let me go back now to the roadmap in terms of engaging leadership. One of the things we found in all the enterprise transformations we've done is how critical it is to have leadership involved in the transformation. All successful transformations that I've ever seen have had active leadership and having them bought in. Well, again, luckily in this particular case, this has not been difficult. We had a formal project kickoff in Admiral Mullen, the chair of the Joint Chief of Staff, in his conference room a couple weeks ago. We had all the senior people from all the services were there. We had all the surgeon generals. We had all the vice commanders and 4-stars from all the different services. We had some of our key advisors from the Veterans Affairs, and the former Secretary of the Army were there. And we had an overview that we presented our approach to what we're doing, and got very, very strong support and concurrence from all of these individuals. And in fact, our big challenge now is that we're going back out and very quickly getting back to every one of them and have asked us to come back and said, so for example, the Surgeon Generals of the Army and the Vice Commander 4-star of the Army has said, whatever you need, we'll give you all our data. This is like a researcher's dream, right? You'll give you any data you want. You have access to all of our people. Just help us figure out how to make more sense out of this. We also have, not listed here, is a group of very senior advisors that are retired members of the Armed Forces and other agencies that are working with us and advising us on this project. So we have probably the best senior commitment I've ever had on any project ever. If we now go to the planning cycle, and this is really where we're focusing right now, is understanding the current state. And we're doing this across multiple dimensions. And we actually are going to be involved in 3 phases over 4 years. The first phase is looking at the current state, and then we'll get into model creation and validation, and then some future scenario planning and recommendations. We will be making, however, recommendations and doing work all the way through this process, so it's not like we're going to wait till the end of 4 years. As we learn things and find them out, we're going to be sharing them and hopefully getting them implemented. There's 4 areas that we're really focusing on that are consistent with the work we've done in the past. It's looking at stakeholders, and I'll talk more about each of these. Who are the enterprise organizations and what are their current processes? How are they currently measuring their performance? And then what kind of resources involved in all these? A key part of understanding the systems, understanding, well, where are the resources being spent and who's involved and where. So there's been a lot of work, as you might guess, been involved with this for some time. There's been RAND reports, there's been dozens of things written, maybe more than that. We're calling out all the key ones in terms of literature so that we're not reinventing things or coming up things from scratch. There's also unbelievable amounts of data available. However, it's all in pockets, it's all over, and no one has looked at pulling it all together. So there's all kinds of pieces of things out there. And one of the things that we're going to be doing a lot of, and have already started, is doing interviews and site visits across the whole system. So we'll be triangulating across all 3 of these to try to understand what is the current state. So let me talk a little more about the boundaries. As you might guess, this is a huge system. This is a huge enterprise. So we had to bound it to start with. And what we decided that we would do is look at active military reserves and their families. So what you can see is that there's a lot of community organizations, and the VA is also a huge player in all of this, but we're going to be restricting our initial analysis to that with those items on those areas on the boundaries. We know at some point we will have to spill over into the Veterans Affairs, because that's where a lot of issues, a lot of ongoing treatment is taking place. But we defined the boundary as active military and their families to start with. So who are these stakeholders then? There's lots of them. There's the whole military health system leadership. And there's a lot of work that's been going on in this area, and there's a whole community of people and committees and councils and senior advisors that are involved with that. There's also operational units, which are really key to this. And so we'll be talking to unit leaders, to medics, to chaplains. So the chaplains are actually a very good source of information. We'll be talking to the people that are doing the leadership in the clinics and the primary care physicians and the specialists. We also have already learned that close to 60% of the care is actually done outside of the military and is purchased. So we have the TRICARE offices, there's contractors, there's offices, there's individual service providers. And then, of course, we'll also be talking to the service leadership, the surgeon generals, the installation management, as well as Congress, and we'll be talking as Congress is very actively engaged in this process. And then last but certainly not least, the warriors, the families, and the units themselves. So they're really the center part of this. So we'll be doing a multi-level analysis from very senior leadership to the people actually out in the field, and then trying to understand what's happening across all of these dimensions. The next thing we'll be looking at are the processes. And we are looking at this from a service member-centric view, where we're starting, you can see the orange lines across the top. Accession is when the service member comes actually into the service. They then get trained, they get deployed, they come back and they get tested and perhaps reintegrated. If they may go back into and get deployed again, sometimes, as you know, multiple times, and then final reintegration to the civilian population, and this is where there's a strong interface with the VA. So if you recall, a few slides ago, I talked about the processes we're looking at. Again, we'll be looking at prevention and resilience. We'll be looking at the ID and treatment, so when someone does come through and come back out, and there's now lots of tests and things that are going on, but how is post-traumatic stress identified? And there's a lot of different questions even on that. How is it being treated? There's a phenomenal number of traditional treatments and some non-traditional treatments that are also showing a lot of promise. And then the last part is how the rehabilitation, reintegration, which again could be back within the service or reintegration back into with their families. So we'll be taking a holistic approach and looking at this as a total system as opposed to each of these individually. And that's the part where there's pockets of things in every one of these that exist, but now we'll be putting it together in a slightly new way. You can't change a system with understanding how it's performing and without measuring it. Performance measurement is a key part. And we found some good news in this front, and the work that we've done so far is that the military health system actually has been working on a set of balanced scorecard and a set of measures that they've been using. That's the good news. The bad news is that their measures are not the same as what the service members or services are using. So one of the things that we're going to have to do, and part of our role in this, will be to bring people together across the military health system, the different services, the TRICARE systems, and trying to look at how can we come up with a set of enterprise measures that we can use to collaborate across all of the different areas and work together with them. And that's part of the role that we at MIT will be playing. The next thing that we'll be looking at is, and we started already, in terms of the resources. And we're finding that there's a phenomenal amount of information out there, but again, it's all dispersed, and it could be buried in different information systems, none of which are connected together. So there's large amounts of data. There's some current models that are being done that take a very data-intensive statistical analysis approach. But one of the interesting things that we're already finding is sometimes the statistics don't really tell the whole truth. And that we have found some of the warnings we've gotten from some of the people that have worked with the service members have said, well, they don't always tell this psychologist on the post-interview exactly what's going on. Or they may not know what's going on until 3 months later. They may not detect these kinds of situations. So it's not like the traditional systems that you can just kind of mechanically look at and you see what's going on. Or it's not like someone comes back with a broken arm and you can say, oh, this is how we fix it. It's not always detectable. So the traditional statistics and data may not be where we actually find the answers. And so we're going to be looking much more broadly than that. One of the things that we'll be doing using systems tools is looking at discrete event system dynamics kinds of simulations and models to understand all these complex interrelationships. And so one of the first things we looked at is just even where is the money being spent. And this is just for the psychological health budget, which is just a fraction of the total budget, and it doesn't account for any of the money being spent at the VA. When you can see the Army is one of the heaviest users, followed by the Navy and predominantly the Marines as the next portion of that. But then as we started to explore, how do we get into the future design and how do we create some of these models, we started to look at what are some of the models that we might want to create and validate, both to understand the current state, but also as we start to think about the future state of this, and how do we start to think about solutions to this. We'll also be getting very heavily into looking at future scenario planning, different kinds of recommendations, different kinds of models, and different kinds of implications on policy. So as we started looking at this, and again, recall on the left, in the peach or the orange color are really the three major areas that we're going to be focused on. But then as you move to the right in terms of identification and treatment and rehabilitation reintegration, those also affect the VA. And so we started exploring where are there existing models. And it turns out not too many already exist. There are some quantitative, however, they don't really adapt and look at the whole total system implications, and they don't look at the interrelationships. So you can see under the treatment area is probably where there's the most right now in terms of epidemiologic mapping. There's some staffing models and some individual treatments, and so there's some work going on, and we want to capitalize on that work and make sure we use it. However, we anticipate having to create new kinds of models and new kinds of interactive kinds of things to understand the full spectrum of treatment. This is what we call in systems thinking or systems theory. We have complicated problems, we have complex problems, and we have wicked problems. And this one is in that latter category. And luckily, because we're in Boston and we're at MIT, we like wicked problems, and this is what we do. So, but it's a very complex system, and I'm just showing you kind of the tip of the iceberg of some of the things that we're starting to see. We're starting to see that there's lots of procedures that are not standardized, or there's different systems in different places, and no one has had the opportunity to really look across the whole system. And so we feel really excited about being able to do that. So as we move more into the future piece of this, we'll be talking much more about now the use of some of the work that we've been doing in enterprise architecting. And one of the things that we've learned in our other work with other organizations and enterprises is that if you want to change something, you have to know not only where you are, but where you want to be. And so we have to, in defining this future state, it's like, how do we define what this really looks like? And how do we find the vision of what it could be like? And it will be actually fun as we get into this next phases of this, where we can start to say, well, what are the things that we're observing? What are the changes that we might want to make? And what are the recommendations we want to make to change to how it could be? And how do we incorporate now these multiple dimensions of the people and the processes and the culture and the technologies, and how do we put these all together? Well, one of the things that we've been using, and many of you have seen me talk about this before, is enterprise architecting. And this is a very holistic approach to where we are taking and integrating the strategy, policy, processes, products, services. Certainly this is very much a service example of an enterprise, knowledge, information, technology, and organization, and how do these all fit together? And these are some of the future state characteristics are agility, flexibility, reconfigurability, but we'll have to define new abilities for this system, and that's one of the future things we'll be getting into is what are the things that we really want to have as the outcomes of this system. And these all work together, and for those of you that are engineers know the gears aren't quite right, but we know that. But it's my little token bit of fancy graphics. So I'll just quickly to go through, we'll also be looking at, how do we align these systems, these policies. I think policies are going to be a big issue in this case. Performance measurement, incentives, how do we get people to then take the recommendations and make changes. We'll have to look at the resource allocation, understand, where should we be putting more, maybe treatment facilities? Where should there be more research expended? How do we make healthcare providers more accessible? How do we now align incentives and behaviors? Are the incentives in the military and the incentives of the family, how do we align those? The families want their people back. The military wants people they can also deploy, but also wants them healthy. So we'll be looking at a holistic alignment of these strategic objectives, stakeholder values, processes, and performance measures. And one of the tools that we have to do that is something that we've used Neosystems, and that's X Matrix. And just to show you the framework for that, we do have methods that we've used before to look at alignment of objectives and metrics and stakeholder values and processes. And we'll be using some of these same tools that we've used in other systems in this evaluation. In creating a transformation plan, we don't know what that's going to look like yet because we're too early in the process, but one of the things that we're anticipating is a refinement of the value proposition that are centered around the warriors and their families, determining the high leverage opportunities for improving the whole continuum of care. And that's what we've done in the past with organizations, is rather than just doing these pockets of improvement, let's figure out where the big impact areas are and revise the policies and procedures to enhance the whole system performance. The execution in implementation is too soon, but we do see implementation happening all along the way, and that will involve commitment of resources and training and implementation and tracking of progress. And I think what's going to be really important is to really get people to understand this whole continuum and to really understand the enterprise thinking that went into it and how all these things fit together. And people recognize the pieces that they're involved in, and getting the people to understand, though, how did this all fit together and how do we monitor and measure the outcomes of this. So and then obviously we come back full cycle to through the whole roadmap, and ultimately hopefully this will affect some of the strategic outcomes of doing it. So in closing, our challenge is really to come up with innovative recommendations, to step back, because people have been working at this very hard, and there's a lot of great work that's been going on. But by stepping back and taking a total enterprise systems view, to be able to look at maybe some things in a new way and from a different point of view. As I was briefing Admiral Mullen and his team, I said to them, well, you probably are wondering, why MIT and what do we know about post-traumatic stress? We're not the experts in post-traumatic stress, but we are experts in enterprise systems thinking and enterprise analysis, and that's what I think we bring to this. So we'll be performing these 3 different kinds of phases of analysis: in the current, looking at the future, and then how do we get there. And we hope that through doing this, we'll have much increased understanding of the total system, including all the stakeholders and the total system performance. And as a result of that, be able to determine high leverage opportunities for improving that total system and also making policy recommendations. And because there's a lot of people that are really looking forward to these outputs and are ready to take action. Thank you. That's it.